Today we'll be talking about autism because the April the 2nd was the World Autism Day, and its theme was inclusion in the workplace. Thank you, Dr. Akindayomi and Dr. Kerry, for coming on the program. It's actually wonderful to have both of you here to share your experiences and your knowledge with us. First, can I ask, for our listeners' sake, what is autism?
Well, if you allow me to go first, thank you for having us on your program, DoctorOnAir. It's always a delight for me to be here. I've done an episode with you before on Down syndrome. Getting back to the issue, what is autism? Well, you know, Pamela, let me be very honest with you. When I look at my son now, who is 35 years old, the definition of autism at that time is slightly different from the autism that we're seeing and picking up now. So I'm not quite sure whether I'm giving you the definition of 35 years old or the definition of what it is today. However, since Dr. Kerry is here and she's got a young son who's about 6 going on 7, she also will be able to fill in the gaps. At the time my son was born, and in terms of my profession, autism was seen as children who were more or less in a world of their own. That's what the classic symptoms or signs were at that time. That these children were not interactive, they were nonverbal, they had behavior challenges, learning challenges, and so on and so forth. So I would say, being very clear for this program, that I still look at learning difficulties, communication difficulties, and behavior challenges. Those are the 3 things that I believe are the fundamentals of autism. But I'll let Dr. Kerry share her own definition if it's any different from what I'm saying.
Thank you. To me, it's not really far from what Dr. Akindayomi has said. With autism, there's some, nervous processing disorder, which affects not just the communication, but also social interaction, the way the person or the child perceives the world is just different from what we typical people and typical children, how we experience the world. And that's because of the way they are processing information coming in to their brain, and the way that information is also being interpreted and being able to come out. So because of that, they have, issues with communication, difficulties with language, also with their social interaction. Behavior is difficult, not because they're just difficult children, but because the world around them is being perceived in a way that is different, sometimes very challenging. And I'll give examples because of our listeners. Sometimes something as simple as a certain sound that a typical child wouldn't find distressing. A child with autism can be hearing that sound at a very high pitch, or in a way that it disturbs their senses, which are, quite hyper sensitive to that sound. So something as simple as that can make a child react in a negative way to that sound. But because, we don't understand, majority of society doesn't understand what's going on with that child. They just feel the child is sitting there covering his ears and screaming, not knowing that it's a particular sound that's bringing out that reaction. So I think it's very important for society to know that children are not just being difficult. It might just be a disorder. It might be some hypersensitivity with the way that they're reacting to the environment. And I think once that understanding is there, then it becomes easier for whoever is managing the child. It becomes easier for that child as well, because then they get the help that they need, meaning cut off that sound, and you're probably going to get that child to settle down. So just to demystify the whole autism thing a little.
I'm very happy you're speaking like this, because I think it's these kind of simple things that make it much easier for people to understand and accept when they see a child reacting in that way. I think that those kind of reactions are common in autistic children. And all the rest of the world wants to do is sort of push them away, lock them in a room, which is obviously what is, that whole issue of the SDG, leave no one behind, totally counter to that. And understanding the issues around what it is they perceive and how they perceive things differently to the rest of us is key. So thank you for that, for sharing that example. It's very important. Now, talking about autism seems to be a lot more common now than it used to be. Can we, I know it's difficult to say how common is autism really, but can we hazard a guess as to why? Because so many theories have come out. Why is autism, people said if it wasn't present before, and have all sorts of theories. Do we know why children are autistic? Do we know why there seems to be more autism in the world today than there was before?
Thank you for that question. However, I look at it this way. Autism has always been with us. And if you look at the history and the research, as far back as, I think, 1940, people were being identified with autism. However, coming back home, this is Africa. I'm sure there were people who had autism, but they were not given that nice little label called autism. And therefore, we didn't know maybe that was autism. However, during the 80s, when my son was born, I think that is when it started coming to play in Nigeria, because when I look at the number of children that I saw during 1980 down to 1990, there were so many boys and families who all of a sudden had similar stories to tell, and then the diagnosis of autism was made. So I believe autism has always been with us. However, in Nigeria, and maybe in Africa in general, we are beginning to diagnose it a lot better and identify those issues in certain children. I also believe that because when it comes to numbers and data, Nigeria, Africa in general, is quite poor in the sort of data that we have. So really and truly, sometimes I wonder how many children do have autism? How many children are being underdiagnosed? How many families, really come out? Like you said, a lot of children that might display these types of signs are locked away, and nobody wants to deal with that. So really and truly, one of the problems that we might be having in Africa, even though it seems like we are able to diagnose it, is that we're underdiagnosing even children that do have autism in Africa and in Nigeria. When I speak about children being underdiagnosed, what I mean by that is that there are still children out there that are not being diagnosed in terms of the autism diagnosis. And therefore, we're not quite sure of the numbers. And I remember saying that one of the difficulties that we have in Nigeria and in Africa is data. And that data is the collection of data is not always on our side. So we really don't know how many children out there actually are on the autism spectrum. So I think Dr. Kerry can then come in and tell us about, some of the risk factors that occur within our society that might cause autism.
Yes, I mean, I totally agree with Dr. Akindayomi. It seems like there's an increase in the diagnosis of autism, whereas it's just more parents making the decision to get diagnosis for their children rather than just lock their children away. But also from the public health point of view, we can see that there's always moving from a point where we, we were eating more environmentally friendly foods. The atmosphere, was less polluted. But now we just had a situation where there was bad fuel in the country. We don't know what kind of toxins came out of that. So when a woman is pregnant and she's exposed to radiation, she's exposed to toxins, she's exposed to some certain kinds of viruses, and that embryo is forming, it could affect the child, and then the child comes out with developmental delays, and are some of the things that I think is also predisposing, and they were seeing a rise. We don't really have very specific numbers for Nigeria, but if you look at America, I think they've had almost like a 50% increase of diagnosis of autism when you compare it to a couple of decades ago. So an obvious rise in the US. And I think it's just that epidemiological transition that's also coming into play as well.
I think also, sorry, Mati, to cut you short. I think the numbers from CDC, from their CDC says 1 in every 66 children have autism. And as Dr. Kerry said, there is an increase. In fact, we noted that most of the developed countries have a high incidence of children with autism, but there again, can we honestly say that without having the correct data that covers the children in Africa and in Nigeria as to what is the situation here? But I do know, like in Japan, they say Japan is is a country that has the highest number of children with autism. Well, you would say Japan is a very wealthy country. It's clean air. It's, it's not like everywhere else. Yet places like Japan, the US have very high incidences of children with autism.
Okay,
prevalence with children.
Thank you for that information. Now, for people who are listening and they're saying to themselves, does my child have autism or does my child not have autism? What are some of the early signs they could see or they could pick up that you would advise a person that when they see this, they need to take their child to see a doctor? And what kind of doctor should they be seeing?
I think, Pamela, again, with all my experience, it's really quite difficult for parents in Nigeria to really identify the signs. Just as when we started the program, we spoke about learning difficulties, communication, behavior, also sensory issues as well. Now, with parents in Nigeria, why a lot of children might not be identified is that we're in total denial. That's the first thing that hits us. We say boys always speak later on than girls. Therefore, if a little boy is not speaking, maybe mama will now come into the whole mix and say, well, you, my son, you didn't speak until so and so. And therefore, this child doesn't have anything, doesn't have autism because when you were a child, this is what you also did. And look at you now, you're fine. So sometimes, yes, we can tell parents that these are the symptoms or the signs that you should look out for. Yet, in a place like Nigeria, rejection, denial also affects the diagnosis. So I would say for this program, for the benefit of this program, one, if your child is not socially interacting with other children, then there might be an issue. If your child by the age of maybe 2, you're noticing is not using language, maybe one word here, one word there, not trying to string words along, then there might be an issue. If your child has certain behaviors, putting his hand over his ears, screaming, stemming, there's something called stemming, flicking their fingers, flicking their fingers, flicking their hands, tiptoeing. might be an issue or an indication that this child might be on the spectrum. But I'm always quite careful because, to be honest with you, and I will allow Mati to speak. I call her Mati, sorry. She's Dr. Kerry, but she's my very close friend. So you might hear me say Mati. I will allow Mati to also tell you her own side of it, that how parents deny all these signs. So we can say all the signs, all the symptoms that we like on this program, but whether a parent will identify their child as having those issues is another thing.
Okay, thank you very much.
For me, with my son, I think one of the first things I noticed was that he wasn't making good eye contact. I think this was at about when he was 1. I was a little bit worried. I was trying to work on that with him. And then I noticed the language was a little bit delayed. Like he would say a word and then he would never say it again. Like his first word was pap, because, I used to make him pap when he was young. I said, "Man, eat your pap." And then one day he said pap and then he never said it again. I don't think he's even used the word pap till now, and he's 7 now. So that struck me as odd. And there was just some of that stemming behavior that Dr. Akindayomi spoke about. He would repeat things, he would repeat movements over and over again. He wasn't playing with toys like regularly, like toys that had wheels, rather than roll them like a car. He would just turn them upside down and keep rolling the wheels. And then he really didn't want to connect with other children. I remember being very worried about this, especially when he was about 2.5 and he started school. And this is something I want parents to really take note of, because a lot of people, even schools, may dismiss those symptoms that you're seeing. And that was my experience. My son's school was like, "Oh, he's okay, he's saying words, he's all right." And I was like, "Can't you see he's not making eye contact? He's not connecting with his classmates." Like all his classmates would like to do what he was doing because he was doing things that were odd and out of the ordinary. So they would follow him. To them, that looked like he was playing. But to me, I could see there was no social interaction. He was doing his thing and they were following him. So that was really my experience. I just had to be proactive. I decided that I was going to get a diagnosis. And that's one of the most important advice I would give to any parent. Get a professional diagnosis. And to me, that professional diagnosis can't be made by just one person. It's a multidisciplinary team, which is something I got when I connected again with Dr. Akindayomi. And we had a team of, like, there was a speech therapist, there was a child psychologist, there was an occupational therapist, there was a developmental pediatrician. I think there were 5 specialists that made that diagnosis. So it's usually a multidisciplinary team, and you would get like the best result out of that than just one person who isn't specialized just saying, "Oh, this child might be on a spectrum." Get a proper specialized diagnosis. That's the best advice. And it really put me on the path to like finding the solution, because they identified where exactly my son had challenges, what were his strengths, and then we started working on that. And he's doing absolutely beautifully now. So that's
wonderful. I think it's actually wonderful, the institution that you have actually set up, Dr. Akindayomi, that Dr. Kerry and others are able to benefit from. And I know a lot of people will actually want to link in with you after this. I've actually, already had hints of that. Now, the first thing, though, I'd like to talk about, or the last thing I'd like to talk about, is the fact that we're talking about inclusion in the workplace, and you have an older child. How have you been able to deal with it? Because I know education is key. And is he able to integrate into the workplace? How have you been able to help your son and others be more included in the workplace? And how much more do we need to do as a society to get us there?
Okay, thank you. Yes, it's time for my son to go to work, to get a job, which for any child or any adult in Nigeria is difficult, let alone someone who has a developmental disability. We had tried actually to take about 5 of the adults to work in the supermarket, bagging groceries, and it had worked for a very long time. I mean, we were so proud of the fact that these adults could actually hold their own with minimal supervision. But when COVID came, a lot of that went underground, and we're yet to pick it up. As I said, when you're competing with people who don't who are not on the spectrum, who are able-bodied, and you've got an adult who is on the spectrum or has a disability, then sometimes there's some difficulties in getting work for people with autism. Nevertheless, in our organization, we have developed a lot of vocational skills. So we have a lot of entrepreneurs amongst our students that are able to do so many wonderful things that can also bring an income, because it's really very important that they also are able to earn. Having said that, it's really very important that our society is an inclusive society. I look at companies today, what is their diversity and inclusive policy like? Why is it that Lagos State says maybe 10% of your working force should have a person with a disability? How many companies are actually following that? If you have a person who is on the spectrum, would he be able to work within your organization if he has the skills that you need? And then I just feel it's really very important that when we have inclusive education, maybe some of these challenges further down the line we'll be able to resolve them. So that is where we are at this point in time. We're hoping to go back to where we were before the pandemic, but the pandemic actually did have a great impact on our adults and what we had achieved with them going out to work.
Thank you. Dr. Kerry, we don't have much time left.
Yes.
Can you tell us a bit, particularly since the spectrum is very wide? It goes from people with Asperger's who have superior abilities to people who have less abilities. Now, what was your take on how to get them included?
Yes, I mean, here in Nigeria, we have our educational system that's quite rigid, really designed to cater for children that are typical, people that learn the typical way, you know, with visuals, with audio, not designed for children with people with developmental disabilities or with autism. So for me, there needs to be that enhancement of the present educational system, moving away from where we have special schools to cater for children with who are neurodiverse, and then we have the mainstream schools to cater for typical children. That has to just change. The rest of the world is moving away from those kinds of structures to where we have an inclusive school, whereby all these children can learn together in the same environment. If we can achieve that, that's really the only way that we can build inclusive societies and really create opportunities for employment for children and people with disabilities like autism, because they're growing up with their peers. Their peers are understanding their challenges, that, you know, being able to accept them for who they are, not trying to change them, but having that knowledge that this person has this challenge. I can help them with homework. I can still be friends with this person. You know, most of the time it's the parents that feed that fear in the children because they're like scared. Is this child going to bite my child? Is this child going to beat my child in the class? But when you put them together in an environment and then they start speaking fondly of that other child who the parent's not sure of, and then the parent realizes, oh, there's nothing to be scared of. My child's not scared of this child. Let me invite them over for birthdays. Let me see how they interact. I mean, my son's school, he's in a mainstream school. We're trying to build inclusive structures, and he's bonded quite well with a lot of students. His best friend is in a class above him, and they're so close. You know, I and the mom have become quite close as well. But if Brian was like in a special school, there wouldn't have been an opportunity for that. So when they grow together, they become adults together, they help each other and employ. It's all about networking in this world. So it's who you know who can help you, who can link you up to an employment, opportunity and position, who's able to give you that chance. So they need to grow up together and learn together. We need to create that opportunity for children with autism. And I think that's what a lot of what I and Dr. Akindayomi and the CDC were trying to do, work with the state government to build inclusive educational institutions and settings.
Following on from what Dr. Kerry said, there's a lot of ignorance, there's a lot of, what shall I say, fear in the society, particularly fear of the unknown. People say, don't let my child play with this one because it's contagious, or they can catch it, or if they bite them, and I just wanted to just talk a bit more about that, because I think it needs to be quite clear how these things, how it is processed, so people can end that fear and can more openly embrace people who are different.
I think for me, it's about, it's not just about us, we've got this, I think we've got a problem in maybe in the world, but particularly in Africa, that it's like we're doing a favor when we have kids like that. You're not doing anybody any favors. Society has to embrace everyone, no matter what their vulnerabilities or their abilities are. And I think I pick up from what Dr. Kerry said. For instance, I will knock our educational system because it's so rigid. So if you are a person that is different in the way you learn, how you process information, then it's a dumb deal, you will fail. And I look at myself sometimes and I wonder, how did I become a doctor? Because if I look at the educational system and how it shattered me, because I cannot, memorize and rotate everything, and then I have to vomit everything that they tell me, and then I will fail. And a lot of people are in that situation. I'm a very visual person. If I can see it, I will remember it. And a lot of people who are on the spectrum are like that. They must see it. It must be concrete. When it's concrete, there's understanding. And therefore, it's not a question of parents being afraid. My kid, who is on the autism spectrum, just like Dr. Kerry's kid, could also be afraid of other people's children. I think it's about time that we look at reduce the level of stigma, yes, prejudice, discrimination,
yes,
within our society. Because if we don't do that, look at what is happening even with people who don't have disabilities. There's a lot of people sitting on the fringes of society because we cannot accept them. And because of that, they're showing us that they're significant and they're coming back to attack us. So let alone somebody who has a disability. In Africa, we have to move forward beyond our traditional thinking, beyond our traditional superstition. Oh, the reason why you have a child like that, you don't have faith. God is angry with you, and all the rest of the nonsense that comes out of it. It's a question of, there are these children think and learn differently. How do we embrace that? That's how I look at it.
Dr. Kerry.
Yes, I mean, it's very interesting. I've had different reactions to parents in schools. There's some parents that are just downright dismissive and not very friendly to me, obviously try to keep their children away. Their parents are curious, want to learn more, and they're just some wonderful parents who just want to understand and want to also be part of the solution. So it's not all doom and gloom. I believe that if there's more information out there, we will get more support from parents, because parents are a driving force, both the parents of the children who have disabilities and the parents of the typical children, because when we are trying to change the system or enhance, let me not use the word change, but enhance the system to cater for both worlds, we need the cooperation and support from the parents of typical children as well. So the more we're able to build their understanding and just get rid of that fear, because there's a level of fear. Like Dr. Akindayomi said, sometimes I go to the school events and I see some children that are typical, but they're also quite assertive and aggressive. And I get worried for my son as well that, you know, I hope that he's not being bullied, or, you know, this child needs to just, you know, stay in his space. So that fear is normal when you have a child, you know, you have that connection with that child. You want the child to be safe. So I don't judge them in any way, but I want that they have the information, and I want them to understand that we are moving away from the way things were. I want them to understand that there's nothing to be scared of. When you're around people that are different from you, you need to understand how to interact with them, and their reaction is just based on what they're perceiving from the environment. Most times they're just being defensive based on what they are perceiving and getting, and then people read that as they're being aggressive, they're trying to attack or something similar. But I would say let's look at it from also a rights-based point of view. It's the right of my son to get an education in an environment where he can grow and learn with his peers in a mainstream school. It's not beyond, oh, help me help my child. It's his right. He has a right to be there. So everyone needs to know that and just accept it and support it. So anyway,
I would go so far as to say he also has a right to a job. All our children, however they are, they all have rights to have a life, to live and to love, to marry and to grow and to have their own families by God's grace, you know, at the end of the day. And this is something that we pray we can all work towards. And I'd just like to thank the two of you for sharing so openly, for sharing, you know, what it is you've been through and how it is you've gotten there. And I just want to encourage you to continue that fight. And some of us will also be behind you on the way. Thank you so much.
Thank you.
Thank you, Pamela. We look forward to your support because, like I keep on saying, people like Matia and myself cannot do this alone. When we have support like you airing these types of programs, it gives us that encouragement that at least people care. People are ready to tell our stories as well. You know, I think sometimes I'm getting tired of all this, and maybe Nigeria has beaten me. And then all of a sudden I come out again. When I heard that you said, oh, you know, we should come on air, I was excited that, oh, Pamela remembered me, that we're still slugging away. And, you know, so it's really important that media gets the attention of society, because media can also help in creating that awareness, positive awareness, rather than the negative information that is out there, and also sensitizing our environment. So
and reducing stigma. Thank you. And
Yes.
thank you for all that you've done, Dr. Akindayomi, over the years. You know, there's so many parents that I know. Dr. Kerry wants to say a few words to appreciate what the work you've done. She's already said something, but I know she can speak on behalf of all the parents that have had help from you. Dr. Kerry.
Yes, I mean, CDC has become like a second home for me, and Brian, he loves going there. I mean, I admit at the beginning I was worried, but I always get feedback from my son, and that's like the best feedback you can get. A child that keeps wanting to go back to the same place. He always keeps wanting to go back. So I know there's something good there, something positive there, and I'm seeing his growth and seeing his skills develop. They're doing a beautiful job. They've had staff that have been with them for years, which speaks a lot about an organization that can retain their staff, retain commitment, have that shared vision. And I've also bought into that vision. I work very closely with them on many of their programs now. And I know a lot of parents have gotten that relief, that help, that solution that's trying to build up their children's skills from the Children's Developmental Center. And we're just trying to just do a lot more. I want to thank Dr. Akindayomi and the whole team.
Thank you.
They know I love them at CDC. And, you know, we're in this together.
Thank you very much, Dr. Akindayomi. Thank you for your work. Thank you. I know this may not be on the radio, but just in case, can you give us a number that if anybody is listening to this, they can reach out to you at the CDC?
Okay, the number is call Ebele on 08098619020. Again,
please repeat.
Call Ebele on 0809 861 9020.
Thank you so much. Thank you everyone for being here.